This is Radio Health Journal. I'm Nancy Benson. This week, the increase in sexually transmitted diseases despite pandemic shutdowns.
I think people's pandemic fatigue has sort of hit a wall, and I've just noticed that patients are out there dating again and therefore getting STDs.
How COVID has impacted STDs when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
But those small businesses, in the aggregate, are 50% of all jobs and 45% of GDP. It's about half the economy.
One economist's theories on post-pandemic America. Then,
it was a life lived much closer to the bone than the more comfortable life that you encounter in the middle class and the suburbs.
Exploring the oil fields of rural North Dakota. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
For the past year, national health efforts have mostly been directed at battling COVID-19. However, another public health crisis has been steadily growing at the same time. Sexually transmitted infections have been on the rise since 2014. And even though the last year has been filled with more time staying home and less time going out, rates of STDs like gonorrhea, chlamydia, and syphilis have hit their highest marks in decades, according to the CDC.
I've noticed that patients who hadn't seen in a while said, you know what, I held out for 9 months. I'm supposed to be sheltering in place, but I can no longer stand it. So I think people's pandemic fatigue has sort of hit a wall. And I've just noticed that, patients are out there dating again and therefore getting STDs.
That's Dr. Ina Park, Associate Professor of Family Community Medicine at the University of California, San Francisco. She's also the author of Strange Bedfellows, Adventures in the Science, History, and Surprising Secrets of STDs. Park says that when COVID cases first arrived last year and states issued stay-at-home orders, rates of STDs initially dropped. But as public health resources shifted toward managing a growing pandemic, they shifted away from STD services. Suddenly, STI community testing sites and primary care settings were forced to shut down or reallocate services to COVID. STD contact tracing was also put on hold.
The STD clinics around the country either had to close their doors or greatly reduce their services. And so we were left with nowhere to go and also people staying home and not having as much sex. So then the number of STDs reported in 2020, just for the second quarter during that shelter in place, went down, but then they bounced right back up. So we don't have final numbers for 2020. But my prediction is as people get fatigued of this pandemic and some of my patients, I can say, are out there having sex again, we're going to end up in a problem that is worse than the one that we had before. As people get excited about having sexual activity again and we haven't done any of this contact tracing for these infections, I fear that we're going to have a surge in STDs once the pandemic subsides.
Besides the pandemic, many other factors could be contributing to rising STD rates. But Park points to dating apps, which have made it easier than ever to find a sexual partner.
One of my patients says it's easier to find a sexual partner than ordering a pizza. And so it's become incredibly convenient for people who are looking for casual hookup to find somebody on one of these apps. The other thing that's happened is there's a new medication out there which prevents HIV. It's sort of like a birth control pill for HIV called HIV PrEP. And it's been revolutionary in terms of making people less afraid of catching HIV when they're having sex. And so there's a whole confluence of factors that are leading to the fact that people are using less condoms and having more sex.
So just how common are sexually transmitted infections? The CDC says on any given day in 2018, 1 in 5 people in the United States had an STI. And Park says that's just the people who knew they had one and sought treatment.
It's incredibly common, and almost every sexually active person is probably going to get at least one during their lifetime. People are walking around unaware. They are having partners. They are spreading this stuff all over the place, and no one is wiser. And then it is the unlucky few who unfortunately do end up having symptoms and then end up having to, go in and get treated. But those that are not having any symptoms at all, especially the young women with chlamydia or gonorrhea, can actually end up with long-term permanent issues if they don't get themselves screened and treated, like infertility and pelvic inflammatory disease and ectopic pregnancies, which, as you know, can be fatal.
Those numbers are even higher for young adults, who account for just a quarter of the population, but make up 50% of STI patients each year. That's according to doctors from the Children's Hospital of Philadelphia. Park says Black, Latinx, and LGBT populations have also been disproportionately impacted by sexually transmitted diseases.
Just to give you an example, out in Louisiana, more than 70% of the cases of syphilis in babies are among African American babies. And so that has to do with lack of access to care and poverty and a lot of other factors that are associated with that infection. And then in some communities with gonorrhea, in both Black and Latino communities, there are some communities that are affected so much by incarceration and violence that there are not as many men to go around compared to women. And so men are having multiple sex partners and spreading the infection more quickly than communities where you have an equal number of men and women, actually.
Even though STIs are incredibly common, Park says for many patients, there's still a stigma around seeking help, getting treatment, and revealing contacts.
You can imagine that it is hard for some people to give up the names of their intimate partners, because when they're being informed that they might have an STD or they might be exposed to an STD, it can bring up questions of infidelity. And, people also feel sometimes a little suspicious, who is this person from the health department and why is the government, snooping around? And people have that feeling.
Park says we need to lessen the stigma if we're to decrease rates of infection. We need to have conversations about STDs, especially with young people.
It seems to be that people are less concerned about STDs. And so for me, as someone who takes care of patients and does research in this area, I feel a little conflicted because I want people to take them seriously enough to go out and get tested and take care of themselves. I don't want people to feel ashamed if they get one because they are just so incredibly common. And so there is a fine line there between wanting people to have a healthy sex life and at the same time wanting people to take it seriously. But when you're thinking about having a talk or the talk with your kids, I want parents to take pressure off themselves that they have to, answer it all at one time, and that really you need to talk to your kids maybe 3 or 4 dozen times about lots of different elements of sexuality, and STIs being one of them. The point is that if they know that you're thinking about this and they know that you're willing to talk about it, if something happens to them, they end up in a sticky situation or they don't know what to do, they know that they might be able to go to you. And that's my goal with all of this, is reducing the stigma around these infections and then making it a little bit easier for all of us to talk about them.
You can find out more about Dr. Ina Park's book, Strange Bedfellows, and all our guests on our website, radiohealthjournal.org. Our writer this week is Libby Foster. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
2 nationwide surveys find that discrimination is a significant barrier to care for people with Alzheimer's and dementia. Half or more of non-white Alzheimer's caregivers report they face discrimination in navigating health care for their recipient. Dr. Carl V. Hill is Chief Diversity, Equity, and Inclusion Officer of the Alzheimer's Association.
The data suggests we have a long way to go to address lack of health equity in healthcare. More than 80% of non-white racial and ethnic groups say it's important for Alzheimer's care providers to understand their backgrounds and experiences. But fewer than half of Blacks and only about 60% of Hispanics and Asian Americans feel confident about their access to culturally competent providers.
The surveys also reveal a lack of trust among Blacks in research clinical trials, and half doubt that advances in Alzheimer's treatments would be shared. These findings are part of the 2021 Alzheimer's Association Facts and Figures Report. Find out more at alz.org/facts.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Certainly by the end of the summer, and I really have reasonably high hopes that we can have a near normal Thanksgiving.
Okay, I'm vaccinated. Now what? Can I finally get rid of my mask?
Then breaking the stigma of epilepsy.
We, over the centuries, have been burned alive. We've been called possessed by the devil. 25% of this country thinks that people with epilepsy shouldn't be allowed to get married.
All that and more on Radio Health Journal.